Hi everyone. Now we are going to discuss about pneumonia. Introduction. Pneumonia is a lung infection causing inflammation in the air sacs, often filled with fluid or pus, leading to symptoms like cough and fever. This can make it difficult to breathe and lead to a range of symptoms like cough, fever, chills, and difficulty in breathing. Next, we are going to discuss about the definition. Pneumonia refers to inflammation of the lung parenchyma due to infection by bacteria, viruses, fungi, or parasites. It ranges from community acquired pneumonia to hospital acquired forms with varying severity. Pneumonia causes your lung tissue to swell and can cause fluid or pus in your lungs. Bacterial pneumonia is usually more severe than viral pneumonia, which often resolves on its own. Next, etiology. The common causes of pneumonia include some varieties of bacteria, viruses, and fungi. Other causes which includes overexposure to cold and chills, diabetes, malnutrition, smoking, alcohol, overcrowding, and poor sanitary conditions. Next, we are going to discuss about the types of pneumonia. Pneumonia is classified by accusation setting, causative agents, anatomical distribution, and clinical features. These categories helps guide diagnosis and treatment. First, we are going to discuss about by accusation. In accusation, community acquired pneumonia, it develops outside healthcare settings, mainly Streptococcus pneumoniae. In hospital acquired pneumonia, which develops onset of above 48 hours after hospital admission, higher risk of multi-drug resistant organisms like Pseudomonas. In ventilator associated pneumonia, subset of hospital acquired pneumonia in mechanically ventilated patients. Aspiration pneumonia from inhaling oropharyngeal contents, commonly in elderly or neurologically impaired patients. Next, by causative agents. In causative agents, it includes several types of bacteria, viral, fungi, and other parasitic, example ascaris, and by chemicals like lipiod and eosinophilic. Next, we are going to discuss by anatomic pattern. In anatomic pattern, lobar pneumonia. This involves homogeneous consolidation of an entire lobe or large portion, often from bacteria like Streptococcus pneumoniae. It shows bronchograms on imaging and progresses through stages like congestion, red hepatization, gray hepatization, and resolution. In bronchopneumonia, features patchy inflammation around bronchi and bronchioles, often spanning multiple lobes bilaterally. It is common in bacterial cases with neutrophil-rich exudate in airways and adjacent alveoli. The next one is interstitial pneumonia. It affects interstitium rather than air spaces, typically viral or atypical. It appears as diffuse haziness on imaging without dense consolidation. The next one is multilobar pneumonia. It extends consolidation across multiple lobes, blurring lines with lobar or bronchopneumonia patterns. The next we are going to discuss about the clinical features. The common symptoms are fever often exceeds 39 degrees Celsius with chills or rigors alongside a cough producing mucus, rusty or blood tinged sputum. Next, in patients frequently report pleuritic chest pain, dyspnea, tachypnea and tachycardia, sometimes with hypoxia or malaise. The patients also informs headache, nausea, fatigue and myalgia occurs less commonly but can accompany the abrupt onset. The next, the physical signs. In physical signs, auscultation reveals crackles, decreased breath sounds, bronchial breathing, egophony or tactile phlegmitis over affected area. Percussion may show dullness with tachycardia and tachypnea as key vital sign changes. In severe cases, cyanosis of lips or nail bed signals low oxygen levels. The next we are going to discuss about the diagnosis. Initial evaluation. A physical exam checks vital signs including oxygen levels through pulse oximeter and listens for crackles or reduced breath sounds. The blood test reveals elevated white cell counts, inflammatory markers like CRP, or cultures to identify bacteria. Sputum analysis examines cuffed up mucus for pathogens under microscopy or culture. Imaging tests. Chest X-ray is the best method for showing lung consolidation, infiltrates, or opacities. CT scan provides detailed view for severe or unclear cases, detecting complications like abscess. Lung ultrasound offers a rapid bedside alternative, identifying patterns like consolidation with high sensitivity. Advanced method which includes bronchoscopy samples over airways or PCR tests to detect viruses like influenza. Severity scores like CURB65 guide admission using confusion, urea, respiratory rate, blood pressure and age above 65 years. Treatment by giving antibiotics like azithromycin, ceftriaxone plus macrolide for 5 to 7 days minimum. The another way of treatment which includes supportive cares like oxygen for hypoxia, fluid, antipyretics, antivirals if influenza related. Hospitalization criteria which includes use CURB65 score, de-escalate based on cultures and stability. Thank you.